Brid Smith, you may introduce.
Thank you. Minister, in June we lost half of the beds in the CAMS unit in Linn Dara in Cherry Orchard. At the time it was promised that they would reopen in September. Half of the complement of nurses was missing, psychiatric nurses. Can you please enlighten us as to what's happening with Linn Dara, and will the facility be fully staffed and fully opened?
Thank you for your brevity, Deputy Minister.
Thank you, and thank the Deputy for again allowing me to address this issue, which is an issue that has been of concern to a number of deputies and indeed senators in the House for quite some time. There are currently 60 CAMS beds operational nationally. This is up from 48 in early summer and will increase further once Linn Dara resumes its full capacity of 22 beds. There are currently 20 operational beds in both Cork and in Galway, 8 in Fairview and 12 in Linn Dara. In June last, due to staffing difficulties, some beds in Linn Dara could not take new admissions. This unfortunately left Linn Dara with just half of its 22-bed complement operational. For those discharged for clinical reasons, the HSE provided dedicated follow-on supports from the community-based CAMS service where deemed necessary. The Executive has also made available the CAMS day service as appropriate in individual cases to enhance supports for young people and their families. The operational difficulties that faced Linn Dara recently arose from problems in recruiting and retaining mental health professionals. Staffing cover had to be augmented in recent times through methods such as staff working additional hours, overtime and engaging agency staff. Funding availability is not the issue in this case. A phased opening of the closed beds in Linn Dara is planned for week beginning the 30th of October. With a graduated increase in bed capacity, the HSE aim to be back at full capacity of 22 beds by the middle of November. This is similar to the approach taken when the unit increased bed capacity originally. The HSE is required to provide advance notification to the Mental Health Commission of its reopening plan. The HSE has been exploring every option to resume normal operational levels and to maximise the use of Linn Dara in the future. The Executive has intensified its efforts to recruitment and a number of staff have been identified to join the service. The Deputy may rest assured that all efforts will continue to be made to address ongoing service difficulties at Linn Dara with a view to reopening beds as quickly as possible. And again, thank you, Deputy, for the opportunity to address it.
Thank you, Minister. Deputy.
I'm no doubt, I rest assured that you're doing everything you can within your own limits, and really this is the problem. The limits are very tight because not unlike the previous conversation that was held about staffing and pay, it is very difficult, and everybody acknowledges it, to recruit and retain nurses in this country. It's even more difficult to recruit and retain psychiatric nurses, and that's not because they have an aversion to working in institutions and hospitals and clinics in Ireland. It's because their pay, their conditions, the stress levels, the pressure on them is wicked, and they'd rather emigrate, and we're hemorrhaging our nurses because of that. And I don't see where you're answering me how many out of the 17 nurses that were needed to fully staff Linn Dara in order for the beds to fully reopen and be operational have been recruited and will be recruited. Now, I know you're doing your best, and I know you say every effort has been made, and I don't doubt your sincerity, but one arm is saying we're doing our best to keep the service going, and on the other arm the Minister for Public Expenditure is boasting about the new pay deal, which is not restoring pay equality to nurses, which is keeping back the ability of the service to recruit in the manner that it needs to. So it's like there's, in tandem, two different competing forces going on here. And I think it is wrecking the very fundamental, essential services like mental health that we need.
Thank you, Minister.
And thank you, Deputy. Again, you asked a specific question there. I think there's 5 new nurses to join the service out there over the next period of weeks. There's a detail there of the different stages of recruitment, but I think within the next 2 to 3 weeks there should be a new complement of 5 nurses. I met with the Psychiatric Nurses Association last week and listened first-hand to the issues and challenges that they face and that their members face, and I will continue with that engagement. I addressed a conference yesterday of the mental health nurses. Maybe it was the day before now, but this week anyway. So I am familiar with the struggles and with the challenges that are facing them, and I, along with my colleague Minister Harris, are determined to try and deal with those as best we can, and will continue to do so. And as I say, specifically in mid-November, Linn Dara should hopefully be back at full capacity, Deputy, and I will welcome any efforts by yourself to ensure that happens and to hold us all to account to that in the meantime.
Final comment. Minister.
Okay. You're probably aware, I'm sure you're aware, today is the 25th anniversary of the UN Convention on Children's Rights. And on Morning Ireland today, the Ombudsman for Children said that the government will be called to the UN to account for the lack of services to children. Now, Linn Dara is a facility for adolescent people with mental health issues. Since June, up until August, 6 young people committed suicide in the area that Linn Dara is located in, between Cherry Orchard and Ballyfermot. And tragically and shockingly, most of them were young women. Now, I'm not saying that they would have all gone to Linn Dara automatically. You have to be suicidal to get in there in the first place. But there are needs for mental health treatment that become apparent much, much earlier on that are not caught by the system, because the UN are calling us in to say you're failing young people, you're failing children, and it is happening. There are so many issues affecting young people out there that are not being caught early enough, and then the services are not there 24/7 for them to access. It's a tragic situation, and it will get worse, because the next generation who are being reared through the austerity years, who have had their special needs cut at schools for 8 or 10 years, who've been in homeless accommodation, not to mention those who are coming out of direct provision and from homeless services back into so-called normal lives. How is their mental health going to be dealt with in a system that is creaking and already failing? And the consequences of it are not just tragic, they are actually criminal. And I think that the UN will have to point this out to you guys when you are called in front of them. So telling me that you've got 5 nurses out of 11 doesn't really, tick the boxes for the reopening of all the beds that are required in Linn Dara. 11 nurses are required, not 5.
I'm sorry I told you had a minute 15.
Yeah.
Minister.
Again, Carla, thank you. Yeah, Deputy, look, I'm not going to go into the micromanagement of the staffing levels out there and the individual nurses and whatever. The issue is clear. It isn't an issue of funding, as it happens, and I'm not saying that defensively. That's a matter of fact. It isn't an issue of funding in this instance. It's an issue, but that's a separate issue again. That's a separate issue again, and there's obviously a number of different issues relating to that. But just to assure you that it isn't an issue of straight-up funding. It is an issue of recruitment and retention of nurses. There are improvements coming out that way. I share your concern for the well-being and the mental health of young people, and I want to see the best system, and I want to see a system we can be proud of. And there are a lot of good work going on and a lot of money going into it, and I want to ensure that we're getting value for the money and that the services are being provided where they're needed. And appropriate referrals as well is another issue, where people are left on inappropriate lists and inappropriately referred and those kind of issues. There are many challenges within the system that go way beyond the issue of funding. If it was just funding, I've said before, it would make the job very, very easy if it was just merely a funding issue. But there are challenges that we are up to fixing, and I hope we can make improvements on over time.